Dr. Scott Sears with St. Vincent Healthcare is just a great guy, always willing to field practically any question under the sun. I don't think there's been a question yet that's come up where he said, I don't. There hasn't been. Now, you don't need to test him today with that either. You can, but all you got to do, call in 406-294-0970. We're going to take your medical questions, healthcare questions for the entire hour here on Montana Talks. Dr. Sears, great to see you. Thanks for popping into the studio this morning.
Yeah, great to be in here. I appreciate coming in.
It's
beautiful.
It's really cool, too, because the last time we talked with you, it's kind of neat that folks across the state get a chance to hear you on the radio, hear you talk about, some sensitive topics that maybe they're afraid to ask you about when they go visit you as their doctor, or they're afraid to Google anymore because now they get these weird pop-up ads or whatever it might be. So you were at a Little League tournament in Missoula, and you said, all these folks from the Flathead that came up to you and said, hey, Doc, hey, are you that guy from the radio? Hey, I got a question for you. So the cool part is we don't really have a formal agenda with today's show. Well, we want to talk about this CNN health report. Well, we want to hear, okay, what are people in Montana asking you? What are the health questions that they're coming to you and asking you about? So that's kind of where we're going to start, and then we'll take phone calls, mix it up with people across the state. But Thanksgiving meals, I know that's going to be a fun one to talk about. You get a lot of people that kind of come up to you, okay, hey, Doc, how do I keep the freshman 15 off for Thanksgiving week,
Yeah, it's a great question, and I hopefully people do ask a lot of questions today. Last time we were on the statewide hour was right before I was over in Missoula, and that's why people had tuned in. I could see how broad your listening group was over there by those who are familiar with it. And so people, should feel free to call and ask. And obviously, I don't know everything, and you certainly can stump me. But this question about Thanksgiving is a popular one, and I love how it's couched. So knowing that I was going to come on for a little bit longer than usual today, I did solicit questions from people who aren't patients of mine. My patients ask me questions all the time, and
Sure.
A lot of times we use those. But these are questions from other patients or just other folks, other friends who may not necessarily want their voice heard on the radio for some reason. But the Thanksgiving one, I love how it's always couched in different caveats. So this one was, I'm worried about gaining my Thanksgiving 5, the 5 pounds I always gain during Thanksgiving weekend. But I can't offend my mom and sisters when they have cooked for days. What can I do? And I love that because it's like putting it on the mom and sisters, as if it's their fault that you can't control what your behaviors need to be around Thanksgiving. But very common question. Thanksgiving's a big deal. Turkey, mashed potatoes, a great American holiday, people laying around, and tend to gain a lot of weight and tend to feel worse after the Thanksgiving meal than before. And there's a lot of really good tips that we can talk about with that. That's a good place to start since Thanksgiving is just a week away.
Yeah, we'll start there right after this. It reminds me, I just had to go to this tweet that I saw from Allie Lockman. She's from Northeast Montana. I think she's at Harvard now. She used to work for Senator Steve Daines. But 538, this political pollster kind of blog, they did a map of America, and here's what your part of America eats on Thanksgiving. And over Montana, it said salad. Now, some people, whoa, no, it's beef country. No, but Allie made this point. She says, this is your annual reminder that in northeastern Montana, salad means some combo of Jell-O, Cool Whip, canned fruit, mini marshmallows, maybe some chopped up Snickers, tapioca, or coconut, and it's delicious. You're welcome. All right, so how do you keep off the pounds at Thanksgiving?
That is a great. A salad is any mixture of things. You could have a Snickers salad. You could have mashed potatoes and gravy with turkey mixed in. It could be considered a salad,
especially if you're Scandinavian. Just throw it all in there. David in Bigfork. David, did you have a question for Dr. Sears here?
I do, and I appreciate you taking my call. It's a beautiful day here in the neighborhood. A little rain. I'm an older guy, and I'm pretty tough. Back in the 70s, Uncle Sam let me fall out of airplanes over jungles, and I didn't really hurt myself too bad. But about a year ago, I had surgery on my right hip, and it seems like every now and again, when I'm doing something, I still work every day, like I'm bending over or going up a ladder or picking up something, I'll get this pain, and it seems to be right on the incision area where they went in and did the replacement. And it's not a muscle pain or a bone rubbing pain. It's like a searing, burning pain. Really, it really hurts. I have to stop what I'm doing and just stand there and catch my breath for about 10 minutes. It's, whoa, what happened?
Like something that shoots down your leg kind of there? David? Is that how do you? So first off, thanks for your service. Yeah, Doc Sears. Any questions you'd have for him initially, or thoughts off of that?
Yeah, David, good question. Let me just ask a quick question. Does it stay right there where the incision is, or does it shoot anywhere or radiate anywhere?
It stays. It's pretty localized right there in that particular area, and it. I thought maybe there'd be some discoloration or a bruise or something, but it just looks, like it did. There's no change.
Yeah, and it lasts how long? Are we talking seconds, minutes, hours?
Maybe a minute or two. But
yeah.
I just kind of stand there and I don't really do much for a few minutes to kind of just make sure it's gone away. Because it's uncomfortable.
Yeah, and kind of my last question there too is, you said a few different activities. It can happen kind of randomly with different activities. Is there any one specific thing you can do that always makes it come? It
seems to be when I'm either, I would say, getting up from a sitting position if I've been sitting for a little bit and stand up, or if I bend over and pick up something.
Yeah.
With my right side, my right arm.
Yeah, these are really good questions, and probably there's a lot of listeners out there who have similar concerns. Maybe not after surgery, but after you change positions, you may get one, kind of hot spot, or a very common one. Many of you out there probably had a condition called plantar fasciitis, and I'm going to relate this to a little bit of what plantar fasciitis is about. Plantar fasciitis is a condition in your foot. All those ligaments that attach from your heel to your foot. A lot of times the telltale sign when someone comes into my office and says, hey, I have this horrible heel pain, I think it's a spur. It's always worse right when I get up in the morning. That first step feels like someone's taking an ice pick and just jabbing it into the same spot every day. And over time, it just gets a little bit better and better. So what happens a lot of times is our ligaments. So you have to remember there are ligaments, there's tendons, and there's muscles. And we call that collection kind of soft tissue, which also has some fat padding in there. Ligaments are really just connecting bone to bone. Tendons connect muscles to bones, and then muscles obviously are everybody's familiar with. And when we get in certain positions, they get really tight, like the plantar fascia at the bottom of the foot. When we're sleeping, our foot is really relaxed, it shrinks up, and then we take the first step of the day, and it actually causes a tearing of those ligaments. If you had a microscope, you could look at those tissues under a microscope and see they actually tear. Causes intense pain. And so it sounds like what's going on with this hip is that you're having some scar tissue there, tight ligaments, and they're probably getting some microtears. There's a couple things you can do. I know we're up against the clock for
Interesting.
For commercial.
So microtears, because I was thinking maybe like it's pinching a nerve or something like that.
Yeah, we can talk a little bit about the nerve as we come back from the break, because there are some simple things people can do when they have pain like this that they can fix.
Dr. Sears, we ran out of time, but we were chatting with David in Bigfork there, and he talked about, sounded like he just got a surgery done on his hip about a year ago. He said, hey, the pain is still there. And then just before the break, you said it sounds like he's experiencing what are known as micro tears, and you said there's actually some things that you can do to deal with those type of micro tears.
Yeah, absolutely. And just to make it clear for people, if you have pain at a surgical site within a couple of days or a couple of weeks of surgery, you need to go in and get checked, because there are certain things that happen that early on. When we're talking a year out, we're usually talking about scar tissue formation. That can get stretched, it can tear, we can have these micro tears, we can have pain. Your nerves can also be hypersensitive in that area because they were cut when you went through the skin to get into the joint, and nerves have very long memories. They hold grudges for long periods of time. Either way, there's some simple things that you can do. One is to loosen up scar tissue. People don't know this, but vitamin E oils and lotions can be applied to scar tissue to kind of loosen them up a little bit. That can be helpful. Cheapest way to do it, buy vitamin E capsules and puncture them, and just use that and rub that on your scar tissue. Sometimes that can loosen things up. Second thing you can think about, whether it's nerve pain or micro tears pain, is what we call hot pepper cream. If you look in the grocery store, it's actually called capsaicin. Capsaicin is C-A-P, capsaicin, S-A-I-C-I-N cream, but it's basically hot pepper cream. It's a fascinating principle, but hot peppers actually cause the local nerves to release something called substance P. Substance P is what signals burning pain. And so if you rub hot pepper cream on the same area every day, your body runs out of substance P, and your nerves can no longer signal this burning pain. And so patients with neuropathy, people with very localized pain like this, where there's an incision, you can use this hot pepper cream once or twice a day, do it every single day. You run out of substance P, you don't get that burning pain anymore. The final thing is you could go in and see your physician and get a prescription. There is a topical form of Advil. Basically, it's called Voltaren gel or diclofenac gel, and you can actually rub that into inflamed areas and decrease pain. So there are a lot of things when the pain is so local, it's this far out, there's not redness, there's not swelling, it doesn't show any signs of infection. There's some very simple topical things you can apply.
And
that
you
would
were
help.
telling me during the break that that's where the plantar fasciitis tie-in comes in, and if you have that shooting, burning heel pain, that the same types of pain, you could use that same thing to treat that as well.
Stretching and topical treatments are very helpful.
All right. Well, I promise we're going to get to the Thanksgiving eating tips here as well with Dr. Scott Sears. But first, let's go back to your phone calls, 406-294-0970. Scott in Whitefish, listening to KJJR. Good to hear from you.
Hey, good morning.
Morning. Yeah.
My question was, is health care a right or a privilege?
All right, great question. Doc, you want to tackle that one?
That is just direct and to the point. And such a great question for the political environment that we're in right now, where people are talking about Medicare for all or healthcare for all, right? Which that philosophy is basically healthcare is a right. If you're coming up with a platform and funding for Medicare for all, you're basically saying healthcare is a right. And yet at the same time, others would argue, well, you have to take some onus on yourself, just like you were talking about. You have a right to bear arms. It doesn't mean that the government's responsible for giving you money and buying your gun and cleaning it and maintaining it and training you in how to use it, right? So healthcare can be perceived as both a right and a privilege. And I think most of the world considers healthcare as a right. In our country, in the United States, not only do most people, I think, consider healthcare as a right, but they consider extremes of healthcare a right. Like, I have a right to go in and demand a $3,000 MRI because my ankle has been hurting for 12 hours. And if you don't give it to me, I'm going to sue you if something's wrong. That's taking healthcare as a right to an extreme, where all of a sudden it's, well, yeah, I have a right to not only have healthcare, but I have a right to demand whatever I want within healthcare, as if it's a McDonald's fast food menu and I can order up whatever I want. So I think what is a right for folks is basic access to health care. And when I say access, that means access to folks who can help you navigate through your own health. And I talked to you about this a little bit earlier. We've talked about this on some other phone calls, is healthcare is a right and it's a privilege and it's a responsibility. That I have a personal responsibility for my own health, and I belong to a country that should be providing me access to healthcare services in a way that I can exercise my own responsibility by accessing healthcare services and discussing with a professionally trained person who's licensed and isn't duping me and just making money off of me to obtain the services that I need to maintain my health.
Well, and I've said this before here on the show too, when it comes to, well, healthcare is a right, and this was big during the Obamacare debates. Well, okay, well, if it's a right, then who are you going to force to go to medical school and acquire all that debt? Who are you going to force to give you that surgery? And you mentioned Medicare for all. As I understand it, the hospitals are very concerned about the impact Medicare for all would have on healthcare and the quality of healthcare in this country.
Yeah, and we've talked about this. It is an important concept for folks. Is Medicare right now basically tells the hospital what they're going to pay for certain procedures and taking care of patients. And it is less than the cost of the service. So it's basically, if you really say, hey, everybody has to have Medicare, the hospital is basically going to say, so you're telling me I have to provide a $500 service to somebody, and it costs, that the cost to me is $700. You're going to pay me $500 to provide $700 worth of services, and now you're going to make me do that with 100% of people. How am I going to keep my doors open? Right now we have commercial payers, Blue Cross Blue Shield, United. They actually pay above current rates in order to subsidize all of the patients who can't afford healthcare services. And that's the way the healthcare system is developed, and it's extraordinarily complex. And it goes into...
If that went away, then who's going to be paying for it?
We would see critical
all?
access hospitals close across the country. And so that's why hospital associations are actively working with both parties, actually, to figure out how can we have a sustainable healthcare system. And it goes back to that right versus a privilege. If you feel healthcare is a right, then oftentimes what happens is other people have the privilege of paying for your health care. And if you choose to smoke, if you choose not to get a colonoscopy, if you choose not to get a flu shot, I have to pay because you chose to do something that harmed your health. So it's a right, it is a privilege, and each of us has a responsibility to take care of ourselves.
Well, I know a lot of the questions that you've been getting from people across the state who knew you were going to be on the radio, and just, what are some of the questions they might have from a medical standpoint to deal with digestion. So we'll get to that. Yeah. And we're taking your phone calls as well. If you've got a medical or a healthcare question, 406-294-0970. But before we get to digestion, maybe we should talk about the intake. Thanksgiving coming up right around the corner. And everybody's asking the doc, how do I keep all that weight off heading into Thanksgiving? I had people ask me the same question because they know I just lost a bunch of weight about a year ago. So. Yeah,
absolutely. And you've done a good job and have excellent tips about this as well. And most people view Thanksgiving as just the start of their weight gain. The average American between Thanksgiving and New Year's gains about 14 pounds. That's an astounding number, 14 pounds. And a lot of it does start at Thanksgiving because of the tradition of eating in a meal. A couple really simple things that you and I talked about. In fact, you brought this one up, is use a smaller plate.
Just psychologically, you finish the plate and you think, oh, okay, I ate a full plate.
Yeah, as big as your plate is, you will fill it on Thanksgiving. And if you want to get the biggest plate in the kitchen, you will fill it and you will eat it. If you start with a small plate, you can fill that plate and do okay. Fill it with vegetables first.
And meat. Get the protein on there.
Get some protein. Yeah. Don't start with a big serving of mashed potatoes right in the middle of your plate. Put gravy on it, turkey on top of that, and then just garnish around it with vegetables. Start with a plate of vegetables, eat those, have conversation. 15 minutes later, go back and eat some other food. Make sure you drink a full glass of water with every small plate that you eat. And that really helps kind of give you a sense of fullness. The other thing, my wife's going to hate me for this one because my favorite dessert that she makes is a pecan pie. She is the best pecan pie maker in the world.
Well, I'll tell you what, let's hold that thought on pecan pie. Let's let people simmer on pecan pie for a couple minutes because I want to talk dessert, because there actually are some really good tips on dessert.
There are.
That involves eating the dessert. We're not saying don't eat the dessert. So we'll get to that here in just a second, but we got another caller on the line. Let's go to Kevin in Bozeman as we chat with Dr. Scott Sears from St. Vincent Healthcare. And the number for you, 294-0970. Kevin, did you have a question or a comment for Dr. Sears? Kevin, are you there? Is that Kevin in Bozeman on line one? Kevin, can you hear us? Okay, he looks like he might be off doing other things. Okay, well, we'll get right to dessert then. Well, our producer will check and see if Kevin's there. But, well, let's go to dessert. So your wife, killer pecan pie.
Best pecan pie ever. The thing is, and people rationalize pecan because they're nuts, right? And nuts are good. They're protein, and they're better for you than all the other pies. A normal slice of pumpkin pie, even with a huge dollop of Cool Whip on it, has about 1/3 less the calories than a slice of pecan pie. Pecan pie has a lot of sugar, a lot of calories. So if you have to choose between pecan and pumpkin, then choose the pumpkin, even with Cool Whip on it. Or just do half and half. Do half a slice of pecan and half a slice of pumpkin. It'll be a little bit less.
My favorite tip, too, and I learned this, I went through a program called Billings Last Diet, which is an ideal protein system. You know, Dale Williams, great guy. But in this holiday eating class I went to, he said this, and I told this to these friends in Bozeman that I saw on Friday night, too. He said, okay, if you're the type that eats dessert 2 hours after dinner, you know, you get stuffed on turkey and everything, you save dessert for later. He said, pair some protein with that dessert. So if you're going to eat that pie or that cake 2 hours later, eat some turkey with it right before you eat the cake, because that protein will balance out the sugar rush that your body's going to get.
Yeah.
Is that a good tip before we get to this break here?
It is a great tip unless you're going to eat a big pile of turkey and 8 pieces of pie.
There you go.
The calories are calories.
Let's hold it right there. Back after this.